There are 4 people that we're honoring, and I'm going to have a brief interview with them. Larry, where's the mic? I need that mic. Make sure Larry Watson give me that mic back for a second. Let me introduce them, and they'll come up to the stage. First, please welcome to the stage Dr. Alvin Toussaint. He's a professor of psychology and faculty associate dean for student affairs at Harvard Medical School. He served on the staff of the Judge Baker Children's Center from 1978 to 2010, including the service as the director of the Media Center from 1994 to 2010. He's also the author of Why Blacks Kill Blacks, a 1972 book, co-authored with James Comer. And he also wrote a book called Raising Black Children, 1992, co-author with, he also another book, Lay My Burden Down, co-authored with Amy Alexander, right? And then his most recent book in 2007, a great book with the co-author none other than Bill Cosby, called Come On People, 2007. Please welcome again Dr. Alvin Toussaint. The next person who's actually spending double duty, he's part of the seniors panel, but we're also going to have him part of the original panel as well. Please welcome Dr. David Satcher. Dr. Satcher has a doctorate medical degree as well as a PhD. He's the director of the Satcher Health Leadership Institute, established in 2006 at the Morehouse School of Medicine in Atlanta. He also served as the 16th Surgeon General of the United States of America. He also served as the 10th Assistant Secretary for Health in the Department of Health and Human Services, making him only the 2nd person in history to have held both positions simultaneously. His tenure of public service also includes serving as director of the Centers for Disease Control and Prevention. He was the first person to have served as director of the CDC and then Surgeon General of the United States. Dr. Satcher has held top leadership positions at the Charles Drew University for Medicine and Science, the Meharry Medical College, and the Morehouse School of Medicine. Dr. David Satcher. And the dean of this group, please welcome Dr. Lewis W. Sullivan. Dr. Sullivan is the chairman of the board of the National Health Museum in Atlanta. He also is chairman of the Lewis Alliance to Transform America's Health Professions, and served as chair of the President's Commission on Historically Black Colleges and Universities, co-chair of the President's Commission on HIV and AIDS, and for 4 years he served as secretary of the U.S. Department of Health and Human Services, president of Morehouse School of Medicine for more than 2 decades, and as secretary of Health and Human Services. He successfully increased the NIH budget, introduced a new and improved FDA food label, released Healthy People 2000, a guide for improved health improvement, promotion and disease prevention activities, successfully prevented the introduction of Uptown, a non-filtered mentholated cigarette. And he also inaugurated a minority male health and injury prevention initiative and implemented greater gender and ethnic diversity in service positions at the Department of HHS. He's also a native of Atlanta and graduated from Morehouse College in 1954, the great decision of the Brown decision. Earned his medical degree, like Dr. King earned his PhD at Boston University School of Medicine. He is certified in internal medicine and hematology. He holds a mastership from the American College of Physicians and is a member of Phi Beta Kappa and Alpha Omega Alpha academic honor societies. He's a founding president of the Association of Minority Health Profession Schools. He's a former member of the Joint Committee on Health Policy of the Association of American Universities and the National Association of Land-Grant Colleges and Universities. He also was an instructor in medicine at Harvard Medical School from 1963 to 64, assistant professor of medicine at Seton Hall, 1964 to 66. In 66, he became the co-director of hematology at Boston University's Medical School. and a year later found the hematology service at Boston City Hospital. Please welcome Dr. Sullivan. And the fourth legend in medicine and healthcare is Dr. Gus White. Dr. White has an MD and a PhD. He's currently the Ellen and Melvin Gordon Distinguished Professor of Medical Education and Professor of Orthopedic Surgery at Harvard Medical School, and former professor in the Health Science and Technology program at the Massachusetts Institute of Technology. For the past decade, he's been a leader in the national fight for equality in healthcare. This is the subject of his book, which is available here, co-written with David Chanoff. It's called Seeing Patients, Unconscious Bias in Healthcare. White grew up in racially segregated Memphis, Tennessee. He's known as Memphis Slim, for those who know him personally. He attended Brown University, where he was the first black president of this traditionally white fraternity. Graduated from Stanford Medical School in the 1950s. He trained at Yale Medical Center, becoming the first black surgeon resident, and later Yale's first black American professor of surgery. It didn't end there. Dr. White served as a combat surgeon in Vietnam, was decorated with the Bronze Star. He earned a doctorate doing advanced spine research at Sweden's University of Gothenburg and Karolinska Institute. In 1978, he was tapped to head the orthopedic surgery department at Boston's Beth Israel Hospital, became the first African-American department chief in a major Harvard teaching hospital. And he's written over 250 articles and book chapters, including definitive textbook, Clinical Biomechanics of the Spine, and a book for back pain sufferers, Your Aching Back, A Doctor's Guide to Relief. It's now in its third edition, and he's the recipient of the Academy's Diversity Award and the Tipton Award for Outstanding Leadership, Stanford Medical School's Lifetime Achievement Award for exceptional contributions to medicine, and other awards and honorary degrees. Please welcome again Dr. Gus White. Is this on? Testing. I'll use this one. Before we present the awards, I want to just talk about where we are today, because we've got a panel of exceptional people coming to talk about health and healthcare. All of you have been doing this for many, many decades. Where are we today, and where do we need to go? I'll start with Dr. Satcher.
Well, thank you very much, Charles. I'm delighted to be here and very honored to be a part of this panel. It's not easy to answer that question. I was thinking that, I think it was January 2000 that we released Healthy People 2010. And one of the goals of Healthy People 2010 was the elimination of disparities in health. This actually was not the first time that we had identified disparities in health, but I think it was the first time that we had set the goal of eliminating disparities in health. And it told me how important language is. I think the goal of eliminating disparities in health actually galvanized people around this effort and has done so since. In that same report, we talked about 4 determinants of health. And actually, these 4 determinants had come from work of Fagan McGinnis earlier. But they were 1, health care, 2, genetics, 3, environment, and 4, behavior. And in that report, Fagan McGinnis had said that health care accounted for maybe 10 to 15% of the variation in health outcome, that biology or genetics for 20 to 25%, environment 20 to 25%, and behavior 40 to 50%. And I think that was shocking to everybody. Number one, it was shocking to hear that perhaps health care was not as critical as we had thought. And secondly, I don't think many people had really dwelt on the fact that our behavior, whether or not we smoke, whether we're physically active, how we eat, and our sexual behavior, things like that, were really the critical factors. Overriding those determinants in that report, we identified policy, but we really didn't say anything about it very much. After I left government, I received a call from the Director General of WHO in 2005 asking if I would serve on a commission on social determinants of health. And for 4 years, we traveled around the world looking at how social issues were impacting the lives of people. And WHO released a report on social determinants of health in 2009, defining social determinants of health as the conditions in which people are born, in which they grow, in which they learn, in which they work, in which they age. And really pointed out that these conditions were impacted by money and power, and recommended that we, in an effort toward global health equity, that we do a better job of targeting the social determinants, income, education, early child development. And I just think that where we are today is an awareness of the importance of social determinants, and I tell students coming into college that it means that each one of us, regardless of the field you're going into, has a critical role to play in eliminating disparities in health and achieving health equity. And I think with that new awareness that so many have contributed to, we're on the same wavelength of saying that we're all in this together, regardless of your field of endeavor, whether it's law, medicine, social justice, the economy, education. You have a critical role to play in the goal of eliminating disparities in health and achieving global health equity.
Thank you so much. Let me go to, if I can, to Dr. Alvin Poussant. It's been 4 decades when you wrote the book, Why Blacks Kill Blacks. We thought that was an early 20th century problem.
I still don't know.
Well, that's part of it. Why, number one. Second question about black children. Both of those, about children and about people killing each other. What's your sense about that? And tell us about those books.
Well, you know, at the time, back in 1972, when I wrote that book, violence, homicide, was the second leading cause of death of young black men. Number 2. It was number 2. Now it's number 1, and it's been that way for decades. That violence, homicide, is the number 1 killer of young black men. Now, even looking at that from a health standpoint, you know, that where doctors are healers, violence is the antithesis of healing, and is part of the issue for health, not just in the violence itself, but the tone that it sets in the community for people caring about themselves, caring about their bodies, caring about their psyche. So it's like on a downward spiral when you introduce violence there as another ingredient that you have to deal with. Now, I can speculate a lot about why I think this goes on, and I think it's very, very, it's not simple. That, you know, a lot of it has to do with the legacies of our experience with slavery and Jim Crow, and being indoctrinated into feelings of inferiority and feeling that black life is devalued, that a black life is not worth as much as a white life. I think that we've internalized some of that, and that often a lot of young black males and women too don't value their neighbors who are black, and even may get into kind of mentality that their life is not worth enough, or even there's something positive in killing one another. And it gets all very, and trying to reach people on that level would be very, very difficult. I think because it's internalized so much. And I think this is where parenting and helping young people care about themselves, care about their health and their body, that will do a lot to get rid of some of the kind of hopelessness that killing each other derives from. And so I think in terms of long-term healthcare disparities, that the parenting issue and raising children to be sharing, loving, productive, and to care about themselves will do a lot, not only perhaps to eliminate homicide, but also suicide. Let me just comment, because that, you know, back in, and Deborah Stith knows this, back in the 1990s, there were about 23,000, 24,000 homicides in the United States. Right now, you know what the number is? It's actually gone way down. It's 13,000. It is the most recent homicide rate in the country, which means that it has gone down among black people, right? Black people, black men represent about 44% of the homicides. And that's still the case, so that they actually are killing each other less. And no one knows exactly why, and you can, if you go to New York, they'll tell you it's stop and frisk, you know. But I think that it's not as dismal as it seems. You know, it's reported constantly in the press, and it's demoralizing. And I think let me just end with this. The Trayvon Martin killing is something that, in fact, reinforces the notion that a black life is not worth as much as a white life. Thank you.
Well, and I want to ask you, thank you. We're going to talk a lot about Trayvon Martin with the second panel, but I want to ask you, and then I want all of you to think about it as well. And this question's been asked to me several times, and I'm not sure what the answer is. Has the number of homicides been reduced from the higher number you talked about to now because young black men are dead? That is, that we don't have as many people to kill anymore.
I don't think that's probably the reason. I think that a lot of young black, people from ages of 15, 17, the birth rate has not gone down considerably, right? I don't know all of the reasons, but it could be that guns are not as readily available. It could be that in fact, a lot of people attribute the decrease to the fact that crack isn't as popular. Sure. And that in the 1990s, crack was on top of the world, and black men were killing each other over crack kind of issues and drug dealing. And that's not prevalent, partly because young people have turned away from it a bit. Partly, perhaps, that a lot of them are in jail because of mandatory sentencing. That's, you know, and all of that mandatory type stuff. Well, let me just say that the prison population is now around just over 2 million, 2.3 million. And at any given time, between 600,000, 800,000 to 1 million of those prisoners are black men. That's a significant number, and a lot of them on drug charges. Perhaps that made the rate go down. I think it should be researched, and people should look into that as one of the factors. And the recent initiative of Eric Holder, right, around incarcerating young men over drug violations. They're going to go after that, as well as some other, the stop and frisk, unconstitutional. That's going to probably put fewer black men in jail. Again, speaking about health, incarceration itself is one factor, risk factor in suicide. And it's also a risk factor for health in general.
Thank you. Let me ask Dr. Sullivan, who really is the dean of all of this in terms of a healthy America, and who on this island has been hosting a walk to make people healthy every year, and it's coming up in a week or so now. Dr. Sullivan, what do we need to do from your point of view to be healthy people? What do you see as the change, if there is a change, from last century to now?
Well, first of all, let me say I'm very pleased to be involved with the program here, and certainly sharing the podium with my colleagues here. And thank you for doing this. I think there's several things I'd like to say. First of all, our annual walk will be a week from Saturday. This will be our 25th anniversary of the walk. And it was started specifically to emphasize the role of behavior in protecting and enhancing health. There are a number of studies that show, for example, that people who are physically active live longer, they have fewer heart attacks, stroke, they are less likely to have Alzheimer's disease, diabetes, obesity. So the emphasis on behavior that Dr. Satcher mentioned is real. The changes can be there. So this is part of what I call personal responsibility. We really, in our country, have a paradox. That paradox is as follows. We have the strongest scientific enterprise of any country in the world. That's shown by the fact that throughout the course of the 20th century, more Nobel Prizes in physiology or medicine came to scientists in American laboratories than in the rest of the world combined. We also have the strongest health professions education system. We train people well. We draw people from all over the world who come here for training that's not available elsewhere. And so we are leaders there. But as noted in some of the movies and my colleagues, comments from my colleagues, in spite of all that, we're not the healthiest nation on earth. But why is that? Well, I simplify it by saying we have a distribution problem. We do not educate our citizens to the things that they can do and must do to protect their health. But it's more than that. We are a diverse nation. 1/3 of Americans today are either African American, Hispanic, or Native American. But when we look at our health professionals, we find that less than 10% of our doctors, our nurses, our dentists, other health professionals come from one of these groups. We are a society that is in rapid demographic shift. The Census Bureau projects that by the year 2042, there will no longer be a white majority population in our country. So what does that have to do with health? I say that providing good health requires two things when you interact with a health professional. First of all, that person must be knowledgeable. We want to have well-trained health professionals. But that by itself is not enough. The enterprise of health requires both science and behavior. It means communicating information, developing trust, ensuring compliance and understanding recommendations. That's where the social side of medicine comes in. That's what we call cultural competence. It means having the knowledge, but being able to transmit that knowledge in a way that's understandable and that the individual will indeed follow it. So that's why diversity in the health professions is so important. As we're becoming a more diverse society, we must see that our health professionals are more diverse. The final comment I'd make is about the disparities in health status. At the beginning of the 20th century, life expectancy differences between whites and blacks was 10 to 12 years. Overall, as a society, our life expectancy in 1900 was 47 years. Well, we've made significant progress in the 20th century because now life expectancy in our society is approaching 80 years. All of us are healthier than we were 100 years ago. But blacks have not improved their health at the same rate that whites have. And until recently, the disparities in life expectancy were there. An encouraging sign is the latest data show that we're beginning to see a narrowing of that difference. So all of that is to say, in addressing the health of all of our society members, not only African Americans, but Hispanics and Native Americans who have terrible health statistics, we must have a more diverse health workforce, we must have more culturally competent health workers, and we must emphasize the important role that each individual plays in protecting and enhancing his own health and that of the family. All of those are important to improving the health of our citizens.
Thank you so much. I was going to go to Dr. Gus White next. I want the doctors here. We had a dinner last night, and I announced the doctors I had some salmon and some salad, trying to be healthy. I stayed away from the ribs and the chicken, but I saw some medical people just wearing out the ribs and the chicken. I'm sure they're healthy, so I just want to hear more about that. I'm not going to press it now. I didn't take photos. My wife always gives me grief about taking photos. Look at that man eating chicken. Look at that man eating ribs. Look at that man eating watermelon. I didn't eat watermelon either, but it was there. But let me go to Gus White. And I wanted to save you for last, Gus, before I go back to the panel, because you have this extraordinary experience, a kid growing up as Memphis Slim in Memphis, Tennessee, going to all these great institutions, integrating them as the first black person, serving in Vietnam as a black physician, and then serving after that at hospitals here. How much does race matter? Because you've written a book about it as well in terms of some of the issues of health that have a lot to do with race. And I wonder if you can talk to us about that.
Thank you. Thank you very much. I really appreciate the honor and the privilege of being here with my highly esteemed friends and colleagues, and to be part of the mission of the Charles Hamilton Houston Institute. I think the approach, the recognition of the pervasive inequities that exist, not just in health, but throughout our society, is a very important thing to emphasize. And I'm really glad that you mentioned Memphis Slim, Tree, because thinking as I thought about Memphis Slim, it's quite appropriate. I think I'm about as out of place here with these esteemed gentlemen as Memphis Slim would be, who's a blues singer, and here with these distinguished guests. But I very much appreciate the chance to be here. Of all the forms of inequality, injustice and inequality in healthcare is the most shocking and inhumane. And that's a quote from the comments of Martin Luther King at a major healthcare meeting many years ago. Of all the forms of inequality, this is the most shocking and inhumane. And just think about that for a minute. We've seen many other examples in the films that were presented earlier. But when are we most vulnerable? When are we most anxious, in pain, unsure of what's going on? It's when we're sick. It's when we're having difficulties. And what do we have to do? We have to go perhaps to a stranger for help. The stranger may even speak a different language. The language of medicine, if you're not a physician, will be different. And the native language that you speak and that the physician speaks may very well be different. And that's a very vulnerable and unfortunate place to be. And it's an important human element to recognize this. And I think as we have emphasized, African Americans in the healthcare disparities, there are 13 groups of people in our society who experience healthcare disparities. I'm not going to go through the whole list, but it includes African Americans, Asian Americans, Latinos, women, and not just minority women, experience significant healthcare disparities. Gay people, overweight people, disabled people, all are at risk to get disparate care. And just one quick example. Tree mentioned a lot of things. I don't think he mentioned that I'm an orthopedic surgeon, but I am. So I'm responsible for bones and joints and taking care of these particular maladies that exist. One of the interesting examples of healthcare disparities, well documented in the literature, is that if you are a young Latino male in Southern California treated at one of the UCLA hospitals, and you come into that hospital with a long bone fracture, a fresh long bone fracture. That's your humerus, your thigh bone, your leg, a fresh long bone fracture. In the emergency room, you have 50% less chance of getting narcotic pain medication for this fracture than a Caucasian male coming in under these circumstances. Now, fracture disease is hard to fake, isn't it? It's not very hard to diagnose. And it hurts like hell. It's very, very, very painful. So this is a very dramatic example of, specific example of hundreds and hundreds of research papers that show the reality and emphasize the reality of these healthcare disparities. This was so shocking that the experiment was actually repeated in Atlanta. And this time looking at African American males appearing with a fresh long bone fracture. And the results were essentially the same. So I think we must be diligent as we correct these various inequities in our society. And it's important, though, to remind ourselves that these are human, these are generic human issues, and they don't just apply to us as African Americans. And part of our strategy, I believe, part of our leverage, I believe, is to make it clear to others and to encourage and incentivize others to recognize that there are 13 groups, and that to the extent that we can correct these inequities in disparities, we will elevate the quality of our health care throughout the nation for all people. And we need to recognize that all people deserve excellent care.
Thank you. I'm about to present each of you with an award. Before I do that, I just wanted to say if you can take a sentence and say, looking forward, what's the most critical health issue for the black community in particular? What do you see for the health issue for the black community? David Satcher?
Well, I actually think the most important health issue for the black community is not health care. I really think it has to do with education, income, safety. And let me just say that in Atlanta, we have a serious school dropout problem. Young black males especially are dropping out of school at a very high rate. And what we find is that by the time they're 30 years old, if they dropped out of school, there's 80% chance that they would be in prison or in some form of incarceration. So, and I think we're losing so much. We have so much information to tell us that people who don't get an education have worse health outcomes than people who do. So there's this direct relationship between education and health. So that means that we've got to find a way to really integrate these issues. I think you know at our institute at Morehouse, which Dr. Poussaint helped to start, the Satcher Health Leadership Institute, one of our programs is quality parenting. We work with parents in the Atlanta community around our institution. 80% of the households are single parents. But 2 years ago, we started a leadership development program for parents, and we just graduated 72 parents in June. I really think by helping parents to impact upon early child development and education of children is probably the most important intervention that we can make. Now, we're measuring, because everything we do, as you know, we try to measure the impact. So we're looking at childhood obesity as an outcome of this quality parenting, but we're also looking at learning and behavior, the kind of communication that takes place between parent and child and how that impacts reading and things like that. So we're health professionals, but I believe that perhaps the greatest contribution that we can make is to really work with parents, not necessarily as experts, but as somebody who's concerned and getting people together to learn from each other so that we can do a better job of helping our children to develop healthy lifestyles early, and that includes education. Thank you.
Dr. White, what do you want people to take away today?
Yes. I essentially agree very much with Dr. Satcher, and I think of it in the context of health literacy. Education is not free, but education is not as expensive as some of the other approaches, some of the economic approaches that are also important. But I think health literacy, if communities and individuals can begin to know as much as they can about their complaints, about their disease, about their treatment. Much of this is available on the internet. And to the extent that you learn that, the reciprocity and the synergies between you and your caregiver will greatly improve the quality of the care that you will get. And in communities and churches, if people can emphasize education, in fact, the new civil rights movement could be education, health education in churches, because it has an immediate, effective contribution to one's survival. And there's a lot of guidelines and a lot of things that can be done to be helpful. The problem itself is tremendously pervasive. It has tremendous inertia in it. It has all kinds of economic disincentives And it's going to be difficult to change those things. They must be worked on also, and they need to be worked on in a careful, strategic way to try to align the various economic incentives so that individual patients can benefit. But what you can do tonight, to help your health is to whatever disease you may be confronted with, whatever process you're engaged in, read about it, learn about it, and that will automatically improve the quality of care. One other thing, speaking of the enormity of the problem, to be respectful of the problem, I have to mention the issue of unconscious bias. The caregivers are not doing things always just because they're mean-spirited, lazy, or whatever the case may be, but there's tremendous unconscious bias. And that unconscious bias follows, I like to think of it in the context of the 10 Commandments. How many people believe in the 10 Commandments? Raise your hand, please. How many people believe in the 11 Commandments? You don't know about the 11th Commandment? Well, I'll tell you about it. What happened when Moses was coming down the mountainside with these 2 big tablets that had all the commandments on them? He slipped and fell. And the tablet hit a rock and broke off. A piece of it broke off, slid down the mountainside, never to be found again. Thereupon was the 11th commandment. And I'll tell you what it is. Thou shalt not commit isms. So that's what we need to be aware of. That's what we need to be aware of when we fight healthcare disparities. The unconscious and conscious isms reflect very much that group of 13.
Thank you. Dr. Sullivan? 12th Amendment, right? 12th Amendment? Dr. Sullivan.
Well, I agree with my 2 colleagues here about the importance of education. It's central. In fact, I think it was 1963, I wrote an op-ed piece in the New England Journal of Medicine about the shortage of blacks in the health professions, and one of the comments in that op-ed piece was, education is central to the health of African Americans, and it's also the pathway out of poverty. So I agree with the importance of education, but I'd like to add to that the importance of having institutions in our society that represent us. We have in our various communities, whether white, black, Latino, what have you, institutions that represent us. Certainly in the black community, the church is a very important institution. It serves more than addressing spiritual needs, but many programs there, whether they are after-school educational programs, the feeding programs, other social services, etc. But also, I'd say it's important to preserve our black educational institutions because they represent us. Because as you've heard, I graduated from Morehouse the year of Brown versus Board of Education. The assumption at that time was, well, we don't need black colleges anymore. Well, that is a mistaken assumption because going to college represents more than the opportunity of gaining knowledge. It's really the time of self-development, self-image enhancement, leadership development, first time away from home independently. What happens to you at that time really determines a lot of things for the rest of your life. So we need to support our institutions, and that means not only with our rhetoric, but also with our funding, because our institutions, which are so important in shaping the lives of our future leaders, need to have funds for those students who are not able to provide the financing themselves. So as we look at ways to improve our health, I agree that education is central, focusing on individuals, but we also must focus and strengthen our institutions. I believe that a truly integrated society is one in which black institutions or Latino institutions, they don't disappear. They are stronger. So they represent the basis of our reality, how we are seen in our society. So our institutions speak to us, and we speak to them. So I would urge all of us, certainly those of us who are fortunate enough to be able to come to Martha's Vineyard on this island, means that we have some resources. Let's use those resources. And the final comment I'd make is, in doing so, you'll feel good. Thank you.
Thank you so much. Final comment before the awards, Dr. Poussaint.
So all of you out there from Ivy League colleges, don't give them any money. They don't need your money. Lou Sullivan is telling where your money's really needed. Now, one footnote to the issue of education. I just want the audience to know, and I have to remind myself of some of the work that I do, that actually we're still in a serious dilemma in terms of increasing the number of minority physicians and black physicians. The number of black applicants to medical school, in fact, peaked in about 1994. And since then, it's gone down and has remained steady and has not picked up very much. So that we have a serious issue in getting black students through the so-called pipelines. And these programs have developed around the country, but they're not meeting the need. We still, right now, when I graduated from medical school, 0.6% of physicians in the country were black, who were mostly from Meharry and Howard Medical School. In 1974, the graduates jumped to 2.2%, and that was because Martin Luther King was assassinated in 1968, and they pushed affirmative action. So the numbers went up. Now, despite a lot of the efforts around the country, the number is kind of stalled at about 6%, between 6 and 7%. Our population, African American, is 13%. So this is a serious issue to increase that number, because the minority physicians, black physicians, have a lot to do with eliminating healthcare disparities. For the women out there, the black women, have gone from about 10% of medical students back in the late 1960s, early 70s, to 62%. They now outnumber black males 2 to 1.
Why are y'all clapping for that? Some more black males in the medical profession. Let me just say, we did invite 2 women who are doctors to be on this panel, and Dr. Jocelyn Elders is ill and could not come. And Dr. Vivian Penn also had a conflict and could not come, but they were going to share their wisdom with us as well. Alvin,
I just want to make it clear.
The point I'm making is that means that the number of black males have actually gone down.
Yes.
And then there's a third factor, which is everyone knows about, but not a lot of people talk about. If you look at the black students now in colleges and in medical school, a very high percentage of them are new immigrant families from Africa and from the Caribbean. Now, that's fine. They should have a chance at education we shouldn't get into that. The point I'm making, though, is that also means that the number of Native African Americans, I'm making a distinction. If you look at affirmative action, it was supposed to be for Native African Americans, wasn't it? But that number is going down, and that we're going to have to make some specific effort through education, to get all those youth, some of them low socioeconomic background, whatever, on tracks for medical school and law school, because they are beginning to disappear. So it's a serious problem in terms of maintaining the gains that we have made over this period of time. So we have to be vigilant and conscientious. My next to final point is that we talk about parenting, but we give it so little attention in American society. I will just go straight to the point. I think that all schools, maybe starting in middle school through high school, should have required courses in parenting for all students.
Won't you join me in thanking our wonderful panel of legends. I'm going to present each of them with a plaque of our appreciation for their willingness to come here and be a part of it, of this great program. The first is to Dr. Alvin Poussant. Next goes to Dr. David Satcher. Next one goes to Dr. Augustus White. And the final one goes to, again, our esteemed leader, Dr. Lewis Sullivan.